I would now like to introduce Matthew Barrington, who will present the class reflections.
So, first and foremost, congratulations to the JCC class of 2018. While we have worked hard and diligently to be here on this night, we would like to recognize that it is our family and our network of friends in this room tonight that have provided us with the love, the support, and the encouragement that has sustained us throughout our educational journey these last 2 years. We humbly, sincerely, and with utmost gratitude thank you all on this day. As our family and friends know, over the last 2 years, our lives have run the gamut of emotions. Together we have laughed, we have more often cried. We've been worried and fearful at times, but ultimately we have felt tremendous joy and happiness looking into the future. Together we have persisted, and together we have endured. We share our achievement together with you here tonight. For those of you who were unable to witness our journey firsthand, we would like to offer you an insight into our lives as nursing students. So it all began with a letter in the mail that we all screeched at that read, "Congratulations, you've been accepted to the JCC nursing program," with a slight caveat. Contingent upon completion of a medication calculation examination with a score of 100%. Before class even started, we had an exam. Welcome to nursing school. We picked up our reading from the bookstore, which included no less than 23 books, several of which were 2,000 pages in length, altogether weighing more than some of our small children. We wondered how we could ever read that many pages. We checked our course manual to see our assignment for the very first class. Read 18 chapters. Welcome to nursing school. We picked up our new uniforms and tried them on proudly, despite the pleated men's shirts that we were pretty sure were women's. And of course, there was finding that pair of 100% absolutely white shoes with no other colors, stripes, emblems on them, even on the bottom. Before the semester began, we walked into our Jumpstart orientation largely as strangers. We were told in this pep talk / reality check with Lisa and Marlene, both congratulations and that we may be entering one of the 2 most difficult years of our lives. Even those who had served in the armed forces later came to think that perhaps this wasn't a bluff. They told us that we may have to miss out on some things in our lives, but to hang in there and all of our hard work would be worth it in the end. This was our new mantra. So we began with the fundamentals in 111 with Kim, with her scooter and boot, who at the last minute took on teaching the entire semester of course material instead of co-teaching as was planned. We read and studied those 100 pages from our Taylor book. We went to our first clinicals, and we experienced our first critical elements, where I think we all personally experienced heart palpitations long before we would actually study them. We learned about bed baths and beyond. We had concept map workshops, We learned in length about the nursing process: assessment, diagnosis, planning, intervention, evaluation, wash, rinse, repeat. And we also learned about nursing diagnoses. And before long, we were diagnosing ourselves. For example, anxiety related to critical elements, exams, BTIs, as evidenced by tremors, elevated BP, and palpitations. Or fatigue related to clinical preparation, as evidenced by bilateral ptosis, decreased LOC, and yawning. And of course, there's imbalanced nutrition, more than body requirements, related to stress eating, as evidenced by accelerated weight gain. You've heard about the freshman 15. Try the nursing school 90. Last, we inadvertently learned about nursing student syndrome, wherein students believe they have the ailments which they're studying. Stephanie had the most severe case throughout the program, and in the first semester, she was sure that she had a brain tumor. MRIs revealed, thankfully, she did not. Those of us who moved on to our second semester felt optimistic and proud to be forging ahead on our journey. We felt we had a grasp of how things were going to go. We were mistaken. We got our first real, true patient assignment in 112, and nobody knew exactly what that really entailed. As we stumbled into pre-conference at 6 in the morning, narrow-eyed and not so bushy-tailed, we compared the times we went to bed the night before. 2 a.m., says one. 3 a.m., said another. And there was one in each group, Cody, clutching a cup of coffee, saying, "I haven't gone to bed yet." We got better at preparing for clinical, and we learned all about patient assessment, IV therapy, pre- and postoperative care, musculoskeletal and neurovascular assessment, and immobility and cast care. While on the orthopedic floor, Stephanie misdiagnosed herself, this time with a bone tumor. We progressed from 5 nursing diagnoses to 15, and we actually felt like we were getting somewhere. Until maternity. In maternity, with Cassandra, we observed the beginning of life, with newborns literally taking their very first breath. She taught us the ins and outs of our ins and outs. It didn't take long for Stephanie to diagnose herself with cervical cancer, another false alarm. Our emotions were tested as we watched new mothers and fathers hold their babies for the very first time, and also when we provided care to neonates who were desperately ill and depended on nurses for their survival. On a lighter note, in class, we learned how to meditate, how to give a therapeutic massage, how to breathe in the flowers and blow out the candles. We won't forget veal chop for fetal accelerations and decelerations, and of course, when in doubt, we will always massage the fundus. We knew that the third semester would be the toughest semester we would face. We would spend countless hours crammed in the library study rooms and make lifelong friendships with many of the delivery drivers from Cam's Pizza. Psychosocial nursing required a whole different set of skills and confronted us with many new challenges. There was this new concept of therapeutic communication and process recording. Katie led us to discover these psychosocial tools, as well as a myriad of psychobiological disorders and trauma interventions, often through an exercise of role play. Our 12-hour clinicals gave Stephanie the time to diagnose herself with a personality disorder, and for the rest of us to be involved in leading group therapy and assisting with recovery, not to mention playing apples to apples and eating therapeutic graham crackers and peanut butter. In 231 MedSurg with Julie and Jody, we learned the realities of becoming a nurse. We tested on IV push medications where we learned that Protonix, an anti-ulcer medication, would, for us, ironically, have the opposite effect. We also studied diabetic medications at length, blood transfusions with fresh frozen plasma, and gastrointestinal therapies. As for Stephanie, this time it was hypothyroidism. Jody would teach us how to be like the predator when entering patients' rooms. She would remind us that, well, that's just the way the ball bounces, and never to call a doctor with egg on our face. And for the love of everything holy, follow the patho. From here on, many of us in a difficult situation would look inward and ask ourselves, WWJD, what would Jody do? In addition to psych and med-surg, we also had a pharmacology class thrown in the mix. We learned with Julie Roy, from her worksheets to her case studies, what seemed like every medication known to modern man. We learned basic clinical pharmacology for drugs across the lifespan, including neuropharmacology, muscarinic agonists and antagonists, cholinesterase inhibitors, adrenergic agonists and antagonists, CNS drugs for neurodegenerative disorders, local and general anesthetics, opioid analgesics, opioid antagonists, non-opioid centrally acting analgesics, antipsychotic agents, antidepressants, sedative hypnotics, central nervous system stimulants, diuretics, calcium channel blockers, beta blockers, vasodilators, antihypertensive meds, heart failure meds, antidysrhythmic drugs, anticoagulant, antiplatelet, and thrombotic drugs. And that was just for the first test. Or at least that's how it felt to us. Now that it's all over, we can say thank you for holding us to a high standard. Our fourth and final semester, feeling so close, yet still so far. Competence and confidence began to prevail, and we all started to feel like nurses. We could see the light at the end of the tunnel, but we were still cautious that the light could be from an oncoming train. We were starting to be amazed at just how much we had learned since we started. Stephanie diagnosed herself this time with vitamin D deficiency, and I'm proud to say that this time, ladies and gentlemen, she was right. We experienced our pediatric rotation at SUNY Upstate. We were driven to Syracuse by Aaron and Desiree before dawn in our white JCC chariot with non-functioning windshield wipers and locks to boot. If you forgot your government-issued picture ID, Tim's dad might be your only hope. We each had a special pediatric client that, again, pulled at our heartstrings and challenged, once again, our strength. After this rotation, we continued to take on more critically ill patients and were able to experience nursing in settings outside the hospital. We were fortunate enough to have Dr. Deborah Marsala come back to teach our seminar course, where we gained insight into transitioning from students to the workforce. We will remember that it was you who took us to Albany to lobby our state representatives to vote in line with the New York State Nurses Association in favor of safe staffing legislation, because safe staffing saves patient lives. In our last round of Med-Surg 232, a 10-credit class, we learned about the artistic talents of Dr. Marie Hess. We could now draw a nephron tubule better than anyone. We know that although all the answers to a question may be correct, we must pick the bestest, and to prioritize the patient who is more worser. She taught us about feelings and how to avoid poor spells, and that you never want to end up D-E-D. We will always remember that in third-degree heart block, the AV node says no. Says no. We appreciate Dr. Hess's willingness to take our class under her wing and teach us in what was then a time of uncertainty. Moreover, we are so very grateful that you continued on as the interim department chair, working tirelessly for this program and always putting students' needs first. We don't know what we would have done without you. As the weeks rolled on, our instructors became our mentors, and our classmates became our family. We all came from different backgrounds and walks of life with the hopes and dreams of becoming nurses. We lost half of our closest friends along the way, which felt like losing part of our family at times. No matter what was going on in our personal lives, we continued to follow the path of becoming a nurse. Many times, this path was lit by our instructors, and although we may not have said it at the time, from the bottom of our hearts, from the apex of our myocardium, we thank you. Your abilities to demand critical thinking, Julie Soule, and provide us with engaging challenges has transformed our clinical knowledge and skills. We are sincerely grateful to have had all of you as our teachers and mentors for your assistance, support, knowledge, and expertise, but most of all, for your belief in us. We are talking about you, Desiree Fuller, Erin Finney, Jen Castle, Samantha Coulter, Fern Corp, Katie O'Brien, Katie Hoystian, Kim Honeywell, Dr. Morgan Crump, Jody Pierce, Julie Soule, Cassandra Widrick Phillips, Heather Barbin, Dr. Marsala, and Dr. Marie Hess. From all of us to all of you, thank you. So, tonight marks the end of a journey, and of course the beginning of a new one. Wherever life takes this flagship class of 2018, and whatever we may do, we will always hold within us these times where we walked together, where all of you turned all of us into nurses. Thank you.